Everybody needs a little morning boost, and for some of us, that's caffeine. So if you need your little cup of coffee or cappuccino or latte in the morning, and you're wondering if it's okay to have that before you come in for your Botox appointment, this is where you need to take a listen, because I will let you know all about drinking your coffee before coming in for your Botox appointment. I'm Dr. Lynn Neiman. I'm a board-certified anesthesiologist, and I'm fellowship trained by the American Academy of Anti-Aging Medicine. I own and operate Blossom Medical in beautiful Winchester, Virginia, which is in Northern Virginia, for those of you who don't know our state so well. And we take care of all things aesthetic in this office. I am a doctor, but I am not your doctor. So this is all information and education for you. Definitely talk about things with your provider, and they can let you know what their specific concerns might be for you individually as a patient. Here we're going to talk about all things education and share things and have conversations about elevated beauty. So hopefully this is a place for you. If you think it is, definitely subscribe, because you don't want to miss the content that we have for you. So let's talk about coffee and caffeine and what that does to you and why it's even a concern. When I was thinking about this question, I went ahead on Google and did some searches myself and just saw what other practices out there were telling people about caffeine. And I was surprised to see how many practitioners were really warning against having caffeine before you come in for a Botox treatment. So let's talk about why that might be and what the actual risk is. Whenever you drink a cup of coffee, let's say 2 cups of coffee, that's about 200 milligrams of caffeine. Your daily recommended intake of caffeine should not exceed 400 milligrams of caffeine. And so that's just an important number for you to keep in mind. But 200 is probably pretty average when we look at studies of what people, adults in America, actually consume. So if you woke up that morning and you had 2 cups of caffeine or 2 cups of coffee and maybe about 200 milligrams of caffeine, what does that actually do to you? Well, studies have shown that having about 200 milligrams of caffeine can elevate our blood pressure. For somebody who doesn't normally drink coffee, that elevation in blood pressure is actually a little bit higher than for somebody who is chronically drinking coffee every day. So you have to know yourself a little bit here. But that elevation in blood pressure ranges anywhere from about, on that top number of your blood pressure, your systolic blood pressure, anywhere from about 2 to about 15 millimeters of mercury. So it can change that blood pressure slightly, and that change can go on for about 1 to 4 hours, so anywhere in that range. Now, on average, it's about 2 to 3. So the range is 2 to 15, but average is about actually 2 to 3. And that's for people who are maybe new to caffeine. People who are chronic caffeine drinkers, they'll have an elevation of blood pressure, but it tends to be a little bit lower. So what is our concern about having elevated blood pressure when we have Botox? 2 things. The first thing is that we are using a needle, so there's a slightly elevated risk of having some bruising after your procedure. That risk is actually pretty negligible, and I don't see that pan out in my practice, where people who drink caffeine in the morning are necessarily having an increase in the bruising that they have after a Botox treatment. Typically with our Botox treatments, we use something called a 32 gauge needle. It's really almost like a hair-like needle. It's very small, and so that risk is really negligible. Here in our office, we also use something called an AccuView, which actually shows us where some of your vessels are located, so we can pinpoint where we want our injection sites to go, so we can avoid bruising altogether. The other thing when you have an elevated blood pressure is that you can actually increase your circulation. And when we inject Botox, we're injecting it into a muscle, and it just takes a certain amount of time, anywhere from maybe 1 to 3-ish hours, for that Botox to be taken up by the nerve cell terminal, where it's going to do its action of reducing the signal from a nerve to a muscle. And as it reduces that signal, the muscle relaxes, and that's how you get your Botox effect. But it takes some time for the nerve cell to actually take that Botox up for it to do its job. So it kind of hangs out in the space around the nerve cell. If our circulation is elevated, so let's say you've had an excessive amount of caffeine, or you're going to go and exercise right after your Botox treatment, which is a big no-no, and here's the reason why. If you increase your circulation, there's a higher likelihood that you're going to wash that Botox away from the nerve cell terminal before it's had a chance to do its work, which just isn't smart. That's not a good value for the money that you've invested in your Botox. So my suggestion to you is, if you are a chronic caffeine drinker and you think that you might be nervous, jittery, agitated. You might get a headache. If you avoid your caffeine in the morning, please drink your cup of coffee. I'm not really concerned that we're going to have an excessive adverse event or an excessive risk of bruising if you have your morning coffee. If you're not normally a caffeine drinker, then I would say maybe for you, let's wait until afterwards for you to enjoy your morning cup of coffee. But after you leave here, I would say maybe give it a couple hours before you would go ahead and have your next cup of coffee. I'm not worried about it being a contraindication. And also, like I said, if you really just are someone who drinks coffee every morning, I would rather you be comfortable in your normal just morning state, feeling rested, feeling good when you come in for your treatment, and not feeling headachy or feeling negative in any way. So can you have your cup of morning coffee? I would say yes. Are you at a slightly sort of negligible increase of bruising? I would say the answer to that is probably yes, just because of that slight elevation in blood pressure. But honestly, when you come in, if you're nervous, you're still gonna have a slight elevation in blood pressure. So I'd rather have you feeling comfortable and like yourself. I hope that helps. And if you like the content of this video, I would really hope that you would subscribe below and maybe even share this video with a friend and let them know, especially if they're a coffee drinker, that it's probably okay to have coffee the morning before they have their Botox appointment. Again, I'm Dr. Lynn Neiman. I hope that you found this content really helpful for you. And if you're in the Northern Virginia area and would like to schedule a consultation with me to go over a treatment plan for Botox, I would love to have you do that. We've got a website, I'll link it below, but it's blossomaesthetic.com, and you can actually make an appointment on the website, or you can give us a call and we'll put our phone number below so you can schedule an appointment by phone if that's your preference. We would love to see you in the office, and we do offer online skincare consultations. So if that's something that you're interested in, just really getting the best skin of your life, we'd be happy to be a part of that journey. Thanks so much for viewing today, and we hope to see you soon with some more tips that can make your appointments go better for you and get better results. Have a great day.